right, welcome to another episode of No Spend Live. Today I'm chatting with my friends and colleagues, Dr. Ned Snyder down the street from me in Austin, Texas, and Dr. Bruce Natta in Indianapolis. How are you guys doing?
Good, Ashley. How are you?
Doing
Great.
great. Super busy. It's a crazy summer.
You guys, of course, in Texas. I'm kind of glad I'm in Indiana. We've done a little better job, I think, of holding things down. But we're starting to see an uptick in cases, I think, pretty much like the rest of the country. So it's crazy times.
Yeah, and I think everybody thought we were going to be really busy when we first reopened just because we had canceled so many cases and rescheduled so many patients. And I think people around the country were thinking, like, is this just the backlog or is it really as insane as it seems? And I think we're all experiencing the same thing where people just really want to have surgery. Ned, are you finding that?
It's nonstop. And it's everybody who was sitting still during quarantine that had been thinking about doing something for a long time that then was upset at themselves for not having booked surgery March 1 or something right before everything shut down. So they could have used that downtime. But also everybody's working from home. So everybody's got, it sort of minimizes the recovery. You don't really have to take much time off from work.
Absolutely. And I think for the moms, the husbands are home. And so it used to be the issue with like breast surgery, like car seats and picking kids up in the crib. And like now someone's home all the time. So no one's going anywhere. So they don't have to put their kids in a car seat. And the husband's there to deal with the crib. And so I don't think I've done as many mommy makeovers in a summer ever.
No, that's the thing. Summer usually for us, yeah, it slows down a bit because people don't want to be recovering, wearing garments.
Right.
And now they're like, hey, I got this opportunity. I got childcare at home. I'm going for this. Yeah. And I think a little bit could be, some people seem to be a little concerned. They've been thinking about doing this. They're afraid there's going to be another shutdown on elective surgery and they want to get in and get it done.
Right.
Well, that's right. And nobody's going anywhere. So there's, the family vacations were canceled. The money that was going to be spent on vacation is sitting still. There's just, nobody's going to, no bars are open. Nobody's going to the restaurants. No. I mean, there's nobody's doing anything.
Yeah. So.
All right. Well, next topic. You guys want to talk about the ponytail facelift?
Ned, you had hair long enough once to have a ponytail. I'm going to let you start.
I'm sporting the quarantine hair now too. I don't want to get my hair cut.
Yeah, he could probably have a little, what do you call that? A man bun.
Yeah, you go.
I could probably pull it off.
Yeah, I think so.
Yeah. So
what do you guys think about that?
Lift? What do you guys think? Is this just?
Well, I think it's just a catchy term, right?
Thing?
It sounds great. I mean, it's sort of. I think a lot of women at least associate being able to put their hair up in a ponytail with sort of pulling their face back. It was an old dancer's trick, and I think it's been one that's been around maybe as longer than facelifts have. Mm-hmm. So people know what the term kind of means or what it suggests, and it also kind of implies hidden scars, which is or that you can wear your hair back in a ponytail and nobody sees the scars or whatever that means, which really is the case with all facelifts or should be. Or nearly so. What it doesn't do is doesn't tell us anything about the procedure.
Right.
So, Ashley, what's it mean to you?
Well, when I first read about it, all I could think was like traction alopecia of the girls that really do pull their hair so tight in an effort to look like Bella Hadid, and get their eyebrows up. Eventually they literally start losing their hair because there's so much traction on their hair. So that's what I originally thought. And then, I feel like it's just a marketing gimmick. I think there's a surgeon in California that's actually trademarked the name. And I'm all about, minimal scars and obviously being able to hide those incisions. But I mean, I agree with Ned. It doesn't tell us anything about the type of facelift. Like, what are they lifting? Is it SMAS? Is it skin? It seems very unclear.
Yeah, that's kind of was my take on it too. In fact, it's interesting. It is. I think all three of us think it's kind of gimmicky, and it's about marketing and all that. And we've seen this stuff. I mean, there's these quick lifts and all these things that are internet-based and TV-based advertising, and it's just about having a catchy name and trying to draw people in. I was kind of I'm so damned old. I remember who was it? T. Wilkins down in your guys' neck of the wood. I don't know if you even remember him, old plastic surgeon.
I remember
Great guy. and he was promoting this concept of the minimal scar abdominoplasty. And the only damn thing that was minimal about it was the results. I mean, you know, you can't do a tummy tuck and take out a little bit of skin and have a little bitty scar. I mean, and to me,
doesn't work.
This is another one of those things where it's minimal, you know, but the results are probably minimal too.
Right.
Again, if we can even agree upon what this thing is, how you define it.
Well, it could be anything, and even in different hands, it probably means something different. Meaning that to one guy who uses the term, it may mean something completely different than the guy who may actually own the trademark. And we have other things that we kind of blanket term procedures. I mean, you know, mommy makeover is one of those. It usually implies something to the breast and something to the belly, but sometimes that's a lift, sometimes that's a lift and implants, sometimes that's just implants. You know, when we talk about breasts, sometimes belly-wise, that's a full abdominoplasty. That might be a mini abdominoplasty, might be liposuction, or with or without liposuction. You know, it can mean a lot of things. So I think it's the same thing with the face, is that you kind of pick a catchy term and it may have a catch-all kind of thing, but it doesn't necessarily tell us anything about what's actually going
so
on.
what's the take-home for patients? What should we be communicating to patients, do you think, Ashley, about this?
Yeah, I think it's really all about, you know, I think it's hard for patients sometimes to really grasp and understand, like, what is the SMAS. I think that kind of gets confusing to a lot of patients. But I think they really need to make sure that they're not getting a skin only facelift, because we know that that's not going to last. There's no such thing as a lunchtime facelift. That's not going to last. And then really looking at before and after pictures, I think really.
I think really, that's so key. I mean, you know, and the obvious stuff too, we sometimes don't always mention this, but, you know, make sure whoever you're going to see does a lot of these cases, board certified, obviously. Make sure that they are doing a lot of these, and ask to see those before and afters. And if somebody's promoting this, have them show you, you know, 5, 10 of these things.
Yeah.
So it's, you're not getting, I mean, for the patients, from the patient standpoint, that they're not getting bamboozled with some, you know, catchy term that this person doesn't really have anything to back it up with. So yeah, I think that's good messaging.
Yeah, I agree. I think that, you know, obviously you already sort of stated all the obvious, but board certified plastic surgeon, and I think photos are maybe the most important part of how you vet who you go to see. I mean, I'm big on pictures in our office, and I know you guys are too, that we have so many of them, and you have, you know, now once you've been in practice for long enough, you've got somebody that looks like almost anybody else that you do, whether that's breast, belly, or face. You can say, oh, look, here's somebody else. She's about 2 years older than you, or 1 year younger, or whatever that is, and looks, you know, kind of a full face or a thin face or whatever that looks similar. And this is what you look like before, and this is, you know, you expect you to get somewhat of a similar improvement.
Well, and, you know, another thing to ask about this for patients, to ask the surgeon, how long is this going to last? You know, some of these little quickie things, I mean, they can look pretty good when you take a, you know, 6-week or 6-month post-op, but what do they look like at 2 years, 5 years? And it'd be nice, you know, if and you know, most of these people that are doing the marketing thing, it's all gimmickry, and they're not going to be able to provide that. And maybe that can keep patients from getting caught in this trap as well.
Right. I love when they show the 6-week photo and it's like they're still swollen, you know, there's not a wrinkle on the face, even though they didn't do any resurfacing.
No, and the patient has makeup on and they're smiling.
And their hair's done, and the pre-op is like hair's like a troll doll.
Yeah, but I think it's important to point that out to the patients. I mean, we see that and recognize it immediately as being a scam. Yeah. But, you know, that's another, it's a little thing, but when somebody's showing you before and afters, you know, if the one looks like their mugshot when they got a DUI and the other one looks like it's a glamour shot, you got to be a little suspect. Sounds good.
All right, guys, any final thoughts?
I don't think so. Good to see you guys.
Think it's just buyer beware, and, you know,
do your homework.
Don't jump at any fad that comes down the pike, or because your hairdresser or nail tech told you it was something you should do.
Right. And please don't put your eyebrows in the middle of your forehead. It doesn't look good.
No. That's right.
All right, guys. Always great to see you.
Good to see you,
Thanks for tuning
Ashley.
in to another episode of No Spend Live.